Good morning. Thank you so much for joining us again for Coffee Conversations with Forge Breast Cancer Survivor Center. So excited today to have Hiba with us. We love having her here at Forge, and she's going to talk about some amazing things with us today. She's been working on some research, and it seems like fun research. It makes me want to go and get another degree because that looked like such an impactful study. But I want to let her tell everybody about what it is that she was studying and what her findings were from that. But before we do that, Hiba, could you please introduce yourself? Kind of tell us, how you ended up in this work, what interests you, and just kind of leading up to this big moment that we're about to have.
Do you have time?
Yes, we've got all the time.
Hi everyone. My name is Hiba Ahmed. I am a doctoral student of occupational therapy. I am also a professional makeup artist by trade. And before I get into everything, I kind of want to explain what occupational therapy is because I don't think a lot of people can really understand or grasp. Because I think most people assume it's physical therapy, which it's not. So
Mhm.
basically, occupational therapy is it's therapies that other allied health professionals such as and speech that we work alongside help facilitate those who lost function or
Hiba, I hate to interrupt you, but there is like a clicking sound on your audio.
AirPods. Do you
It
think it's
could be your AirPods. I'm not sure.
human? Kind of
Yeah, because it's like we can hear some moments clearer and then some moments where it's like click, 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 click.
Does this sound better?
Oh, so much better. Okay, yes.
Sorry, everyone.
No, you're good. You're good. I didn't want you to give us your whole spiel and we're just like, we don't know what you said.
Okay, so occupational therapy, what is that? Basically, it is a sort of therapy that helps rehabilitate a person and it looks at it as a client centered view. So, let's say you've had a stroke, cancer, or a traumatic brain injury, and anything like that, you've lost your function. We really help you do that through occupations, which an occupation can be anything. Combing your hair is an occupation, brushing your teeth is an occupation, going for a walk is an occupation. Everything we do is an occupation. So if there's something that's meaningful to you, um, that you want to do to help with your journey to restore your function and your independence back, that's where OT comes in. So, how is that with breast cancer? Well, let's say you've had a surgery on your breast and you can no longer, like, it hurts too much, or you have limited mobility with combing your hair or anything like that. We can help you get to those steps to be as independent as possible. So that's kind of like an example. And so to mix that in with makeup, that's also an occupation. And fun fact, it's an ADL, which is your activities of daily living, because it goes under the self care, which is so important. And most people typically, that I've seen with research, we focus on the brows, or not the brows, the wigs and the mastectomies. But I feel like makeup can be a form of therapy and make it therapeutic because we kind of look good, feel good, whatever, what have you. So I wanted to build the gap in literature and research that for breast cancer survivors and figure out if it helps improve their self esteem, body image, and things like that.
So, what are some ways? And by the way, I think that that's so unique, and I love that you kind of thought outside of the box on like how can we utilize occupational therapy and defining what it is. Because oftentimes, like even I have been guilty of thinking occupational therapy is picking up some weights and stretching, and I was just like, oh, okay, it's physical therapy, but learning more is a sign of living well. And so I think that it's really cool to think outside the box and say, well, what is something else that we can do, especially for the breast cancer survivors, that is a part of your daily living or can be a part of your daily living? And how can it improve your state of mind or you're feeling good in whatever aspect you're looking to grow in? So what are some ways that or what are some things that you kind of did to get this research going, and like kind of tell us what are your findings so
Yeah. So what I did was I conducted some makeup classes I did 9 makeup classes over the course of 3 weeks, and each week offered 3 different time slots, but it was on the same topic. So the first week was all about eyes, where we learned how to do eyeshadow for things that are complementary to your eye shape. If you have hooded eyes, if you have downturned eyes, upturned eyes, almond eyes, all the eyes. We did it for eye color and just the basics on how to um, get colors with color theory, how it looks best for them. So we did that on week 1. Week 2, we did brows and lashes, which was a hit, where I helped these participants with their brows and their lashes and how to put them on and do the application, as most of them had experienced that hair loss. So this was really meaningful for them, which was really, really fun. And then the last week we did all about face, where we learned how to foundation, shade match. We did concealing, contour, highlighting, blush, all of it. And that was the week of hot pink. So a lot of them, whatever they learned, they were able to apply it for hot pink, which is really cool. And then the general consensus was like verbally, before I go into the research findings, just talking to these participants one-on-one, they've all told me in person, like, this has helped their confidence. One person was not comfortable leaving the house without makeup, but didn't know how to do it without her skin reacting too much after undergoing chemo. And it was just that having community in a non-traditional setting, that's not at a hospital, that's not at a clinic, but just to go with your peers and have that support, and you guys are just being girls again and putting on makeup. I think that was really powerful. And then the findings, general consensus was that it did improve the confidence. So that is good. That's what we wanted.
Yes, that's amazing. I would hate for somebody to put makeup on and, took the fact, yeah, no. So
It's
I'm
like
so
not
glad that it was.
exactly, and it wasn't like doing a full glam. It's just, let me fill in what little brows I have and help me make me feel more beautiful. Let me cover up this. My skin is changing from the chemo and it's red. Like, I just want to feel normal again. So it just gave them that sense of control. And that's what it's there for. It's therapy.
Yeah, and I love that you mentioned giving self-control because nobody chooses breast cancer, nobody chooses to
Exactly.
have any reaction to any treatment. You're just kind of left with the residuals of whatever those things cause in your life or in your body. And so I love that you recognize like there needs to be a sense of control for individuals, and here is something that you can control. So in doing your research, I also wanted to know if you could share some of those things, specifically for anybody on the call that you think might be helpful. Just any tips for anybody who's thinking, okay, maybe I might try makeup as occupational therapy. What are the first steps for them to explore OT? And then specifically, if they want to try doing makeup and they want to do makeup as OT, what are the first steps, and kind of just walk us through what that would look like? How is somebody mindful of those things?
Well, there's a sort of different components to it, knowing who your audience is, because I think a couple of the individuals that I had in the classes had like visual deficits, so they couldn't really see really up close to the mirror or far away. So kind of making that OT in a sense, it's just to adapt the mirror, maybe get a magnifying mirror, maybe go against the window for better lighting. So small things like that can make it more OT. And then as far as the makeup part, which is more fun, it just again depends on the person. Are they what's their complexion? Do they have a cool undertone? Do they have a neutral undertone or a warm undertone? And what that basically means is, do you have more? So in color theory, we have red, blue, yellow, right? So the cooler is going to be our blue, and our warmer is going to be that red, and then the yellow kind of helps neutralize those two colors. So you kind of want to identify, do you have more coolness to your skin tone or warmness? And that can help with finding the perfect foundation for you. And then there's different types of foundations that you can go into. If it's a skin tint, to have a lighter coverage, something medium, if you want that full coverage look, there's different options for that as well. So that would be a good step to start there if you want to do foundation. If you want to do more daily looks, a great concealer, it's great. Just throw it on and go. You can use your fingers. You can use your fingers as your tools. Blush. Blush brings that color and life back into your skin. We don't want to walk with one dimension on our face. We kind of want some color back. So blush is really great for that. Um, and I think just experimenting with different tools like brushes or sponges or even your fingers, see what works best for you.
I never thought of blush as adding color back to the face.
It is so important. Do not skip blush. Literally,
I'm
I
on
would
mine.
wear no makeup and put blush, and I'm like, oh my gosh, I have a full face on. Or pinch your cheeks, something to get that color back.
Because I never use blush. I'm new to makeup, and you know, it can seem intimidating if I'm honest. I mean,
It
because
really can. There's so many options.
yeah, and like I don't know what my undertone is. I didn't even know that was a thing for makeup. We did a coffee conversation with a cosmetologist some time ago, and she mentioned that, and I didn't ask, but I'm going to ask you because you know. But like, how does one find out? Because I mean, I'm looking at myself in the camera right now, and I'm like, I don't know what my undertone is. I know there's flesh under here, but that's all I got. So if somebody just kind of needs help with the starting point, like I don't know if I need to, you know, buy this color or that color, or, you know, like how do they find out what color palette is best for them as they're trying to like make those small steps to begin their makeup journey and utilizing it in a way that just makes them feel better.
Yeah, I think something that anyone can do that's really easy is that where you won't have to go out and purchase multiple products. I'd highly recommend going into your local makeup counter or store like a Sephora, MAC, Ulta, department store, whatever that is, and get three different types of undertones, like a warm, neutral, and a cool. And what most people usually recommend is to do three swatches of each color on your jawline and let it sit for like a minute or so to see if it oxidizes, which what that means is when makeup products is exposed to oxygen, it changes the color. So you want to let that sit so you know that true color match. So you do three step, and that's what most makeup artists do on different clients. We'll swatch a couple of different shades just on the jawline to let it sit and marinate and see what color looks best on you. So that would be my best advice, is just to go in person. Um, and see if there's a brand or whatever you're interested in and grab those different undertones and swatch. And once you get a picture of what works best for you, then you can go in and be like, okay, I know I'm cool. I know I'm neutral. But also, different brands have different ways they do things. So it's always good to try if you can. And especially if you have sensitivities with chemotherapy, I would highly recommend looking into clean beauty, which it may be a little bit more pricier, unfortunately, in this market. But I think it's a great way to find something that's more comfortable for your skin. So I know Sephora carries a clean beauty line, which it's just free of any sort of harsh chemicals. Um, and it'll say it's like a little green mark. So if you're really interested in trying on those products and you're scared about your skin, then I would also recommend trying those out before you buy it, because it's a commitment to make such a big purchase.
Makeup can be very expensive, and I have been guilty of going to the beauty supply or the Dollar Tree because I mean,
Hey, no shame in the game.
yeah, I mean, some of the cheaper products are okay too. I mean, just you know, finding what works for you.
Absolutely.
And I didn't know that about makeup. I didn't know that putting the swatches on your cheek will oxidize. I didn't know there was a science behind that. I mean, are
Oh,
there
yeah,
any
absolutely.
science things that you think that, I mean, aside of course being um aware of like my skin is reacting to this or whatever have you not, are there any other things that especially breast cancer patients should be aware of before they go in to purchase makeup, or when they purchase it? What are some signs that they need to look for saying, hey, this is unhealthy for my skin? Because maybe it doesn't show up as a rash, maybe it shows up as something else. What are some things that they could kind of keep an eye out for as they're kind of navigating this new space?
Oh, well, absolutely. So again, I'm not a doctor of medicine, so this is
Right.
all your own choice. I'm just giving my advice and opinion, not that. Okay.
Mhm.
So I would just recommend something that's free of alcohol, parabens, and fragrance. Those are the big ones. Specifically fragrance. You really want to stay away from that, which is why I keep suggesting that clean beauty, because it is free of all of those things. So that's what I would highly recommend. But again, if you're balling on the budget, like most of us here, I guess just try it and see how your skin reacts. Um, and just go from there if there's not an option to try it on, but try to avoid, like, at least try to avoid fragrances.
Okay. Didn't know there was fragrance. I'm learning so much. I didn't know it. I just thought all makeup smells the
People
same.
will throw in like perfume scents. I remember there was a Huda Beauty. Do you guys know Huda Beauty?
Mm.
She's great makeup products. Y'all need to try her setting powder. But she used to put fragrance in her foundations and her powder, and you just could not breathe when you put it on. But the product was so good, so she came back out after listening to all the criticism, saying, "Take the fragrance out. Your product is great. Please remove it." And so she came out with that. So a lot of makeup brands do put fragrance in their products. But I guess we're moving more onto that movement of let's not put all these added ingredients.
So when somebody wants to, they've done all of the things because there's also a right and wrong way to take makeup off. There's a right and wrong way to practice healthy skin with makeup, like probably not sleeping in it. But if you could tell, I mean, I get attached to my makeup sometimes. Like if I feel like I did a really good job, I'm like, I just want to wake up like this tomorrow and I don't want to redo it. But if you could just give us some healthy tips on ways to make sure that you're taking care of your skin when you're removing the makeup. Like what's the best way to take makeup off and make sure that you're not overwearing and all of the things.
This is my favorite question. Thank you so much for asking. I am so passionate about this. Okay, so I want everyone to say goodbye to makeup wipes. I don't think they're very good on the skin. They're very harsh. They pull and tug. It is not the best thing. So there's this thing called double cleansing. So a way to melt your makeup off at first, and then you go in with a face wash. So you can use, I've just started using this because it's a more affordable option. And one of my makeup friends told me about it. But Pond's, do you guys know Pond's? They have a cold cream makeup remover. It's like $5 at Target, lasts forever. But you want to put that on. So while your makeup is dry, do not wet your skin. You take either oil based remover. You can use a cleansing oil. You can use a cleansing balm, or you can use that Pond's cream and just melt that off of your face, and then you go in with your face wash. But that way, it really helps make sure that your face is completely clean of makeup. For an additional step, if you want to, you can take micellar water on a cotton pad and remove your makeup that way as well. Or you can just use micellar water to help take it off and then go in with that face wash. But it's really important to protect your skin and make sure there's no makeup on it. Don't let it sit, because honestly, the most important part of makeup is skincare. Prepping the skin, making sure your skin is hydrated, making sure it's replenished, making sure it's plump and bouncy. So we want that skincare. So removing it is very, very important. Please don't sleep in your makeup.
I'm guilty. But I have done
Don't
better.
sleep in your makeup.
I've only slept in my makeup once this year, so that's pretty good. It's
I'll
November.
take it.
And I only wear makeup like 3 times a week. But thank you so much. And recently learning like there is a wrong way to remove makeup. Just you have to be careful, I guess, of like what products you're putting on your skin, even when cleansing your
Yeah.
skin, or if you're rubbing it into your skin or rubbing it off of your skin.
It's too harsh. Your skin is so gentle. So you really want to take care of it. So I would not recommend doing the wipes.
Well, Hiba, this has just been so wonderful. I'm so excited for all of the education that you will bring to the world about other ways that they can practice OT. And thank you for thinking of the breast cancer community and saying, hey, like as a woman, you want to wear makeup and you probably used to wear makeup, but your body's changing. Chemo's had an effect, radiation, whatever it is, it's changed so much in you. Here's something that we can control and we can learn it together. And so I really just thank you for providing that safe space for survivors and allowing us to learn so much more about this.
Thank you so much, Janetta. I really enjoyed every single second I've been here at Forge. I've really enjoyed getting to know and connect with all of these survivors. You guys are so near and dear to my heart and will always be. So thank you so much.